So our program is kind of a hybrid between the University of Oklahoma College of Community Medicine with the sports medicine department there, and then we rotate a lot and work a lot with the advanced orthopedics as well, who does a lot of the team coverage for the University of Tulsa and Oral Roberts University. So we're kind of split 50-50 between our time between the two, and so it gives you just a large opportunity to see kind of everything throughout the community and cover every event that's basically going on in Tulsa.
My name is Dr. Jason Deck. I'm the program director for the Primary Care Sports Medicine Fellowship here at OU Tulsa. I am a Tulsan born and raised. I grew up here, went to high school here, did my medical school at the University of Oklahoma in Oklahoma City, and did my residency in family medicine down there. And then I did my fellowship here at the OU Tulsa program. So the thing that brought me back to Tulsa to do my fellowship was that this was a really compact fellowship. We cover two Division I schools that are about 8 or 9 miles apart, and everything else that happens in the fellowship happens between those two schools, which really meant I spent more time with my patients and more time doing sports medicine.
We're very proud of the fact that we have a sports medicine fellowship that's one of the oldest fellowships in the country. I was brought into the department by our chairman at the time to really grow and develop that program, not only to just go and do a sports fellowship, but they want that ability to interact with all of the teams that we take care of in the community. They like the fact that we get to take care of different high schools and different colleges and even professional teams.
One of the other attractive things about our program is that, to my knowledge, this is the only program in the country that the fellow gets to travel with the football team to all of their away games. Which really creates a different experience. A lot of times we let the fellow do the main contact with the athletes. Sometimes the fellow is the only physician on campus. Actually, a lot of times the fellow is the only physician on campus, and if they have a question, we're always available to them. For the bigger sports like football, there's usually an orthopedic surgeon on the sideline too. But for some of the other sports like soccer and basketball, a lot of times our fellow is the first and only contact for those athletes unless he needs to take it up to the next level. All of the athletic trainers at both universities that we cover will contact the fellow first before they contact any of the attendees for any questions or concerns they have about their athletes.
We are very procedure heavy, so from day one we're working on ultrasound guided injections as well as just diagnostic injections as well. So you're going to become extremely familiar with how to use an ultrasound, how to also prescribe medicine. So in the prescribe exercise in the physiology lab where we were throwing people on treadmills, measuring their lactate threshold. So we're doing that on a weekly basis as well. And so you're going to be able to inject every joint in the body throughout this fellowship. And then the pathology is just anywhere and everywhere. It's not just seeing bones and joints here. You're going to see random medical complications from any sort of sports injury, and not just college athletes, but just from active community members as well. So that's a huge selling point to this program.
In the fall, when the TU football team is having their fall camps, this fellow is spending a lot of their time at the fall camps with them because that's most of the morning, every morning that they're doing that. As far as being in clinic, our fellows spend time both in primary care clinic with us at the OU Primary Care Sports Medicine Clinic. They also spend time with Advanced Orthopedics, which is our orthopedic partner here in town. We have 2 orthopedic sports medicine surgeons there that the fellows work with. Also spend time with me. We have a dedicated afternoon once a week to practice ultrasound training. We have a weekly didactic session, and so usually that involves discussing a couple of journal articles. This year it's been on Zoom. It's actually worked out fairly well to work that way. It doesn't feel as much like work as a residency does. You're doing what you want to do. You're covering sports, and so there are a lot of hours. We're covering probably at least two to three nights a week, covering some sort of sporting event at one of our schools. But you're there and you're enjoying the sports, and if they happen to need a physician, then that's what you're there for.
Yeah, so as the sports fellow at OU Tulsa, we have the opportunity to cover 2 Division I universities, one being the University of Tulsa, the second being Oral Roberts University, where you cover every sport and every home game essentially that's going on with them. I think we're the only fellowship in the nation where the fellow gets to travel to every away game with a football team, and we do that with the University at Tulsa as well. So between that, and then we have training rooms where we see athletes not only for sports injuries, but also just for primary care injuries a couple times per week. And then we're also responsible for covering one of our local Tulsa high schools, with that being Booker T. Washington. So when we're not traveling with the football team, we're going to be covering those home games as well. And then we'll always do the Tulsa, the Route 66 Marathon, the Tulsa Tough, Boulder Dash, and any other event that's just randomly going to be in Tulsa. We're extremely connected within the community, so they're always saying, hey, let's get the fellow in there to cover. So we're basically all over Tulsa.